The last challenge then is kind of separate from the whole question that most people are taking a look at, which is the individual mandate and severability, and that is that the Healthcare Reform Act, Obamacare, also included a massive expansion of the Medicaid program to try and cover more people who are poor. Plaintiffs are arguing that this is unconstitutional. Could you explain the plaintiff's argument and what the court will be hearing on this?
Sure. This is, as you said, a separate challenge, has nothing to do with the mandate. It has to do with this, the Medicaid program. The way it works is that it's an optional program for states. States can opt into Medicaid or stay out of it. It's existed since 1965, and the way it works is if states opt in, the federal government will match their healthcare expenditures for these specified populations at a level depending on the state, up to so far between 50 and something like 83%.
So it's generally a good fiscal deal for the states. Some states put in as little as 15 cents, and the federal government gives them 85 cents for every dollar that they spend on the Medicaid population. And even the worst states, as far as federal matching, they put in half a dollar, and the federal government equals that.
Yes, it's a very, very good deal for the states, except that it has, precisely because it is such a good deal, it has driven states to expand the Medicaid populations on their own to the brink of fiscal ruin. And what Obamacare or the Patient Protection Act does is it basically takes states up on that offer and says, okay, from here on out, you will cover everyone up to 138% of the federal poverty line. And in order to make that feasible and viable for you fiscally, we the feds, will pay in the initial years 100% of the new populations. And then in the out years that the ratio drops to 90%. The states say this is coercive because we are basically locked into our past commitments with respect to Medicaid. We can't opt out. We have to undertake these new obligations. The Supreme Court has, at times, in a handful of cases, hinted that there might be a problem with these so-called conditional spending programs. There might come a point where inducement or incentives turn to coercion. There is no case, and there's not even an appellate federal case that has followed that line of reasoning and said, yes, this particular conditional federal spending program is coercive. I really, really doubt that the Supreme Court in this case will sort of pursue that line of reasoning and thinking.
Why? Why do you think that this is a unpersuasive argument that the court would basically uphold the Medicaid expansion?
I think that it's very implausible to argue that the more generous the program is, the more coercive it becomes. But that has to be the plaintiff's argument, and that is, in fact, the plaintiff's argument. So it's basically when conservatives used to complain about unfunded mandates, it was that the federal government put in too little money and then tacked sort of very expensive regulatory requirements onto the federal funding. Education programs are an example of that. Now the argument is exactly the opposite, which is it's too generous and we can't say no. So that's one. And the second thing is that I think the second factor that will persuade the court is that Medicaid is going bankrupt with or without the Patient Protection Act. With or without that act, which adds only 1 or 2 or 3% of expenses for the states going forward, they're in a bind anyhow. We'll have to do something about this program, and I think the court will recognize that. So the states' problems with Medicaid aren't induced by the Patient Protection Act. They're in the sort of pernicious incentive structure that's built into the program in the first place.
We have 4 questions to be heard over 3 days, and the decisions promises to be both important and convoluted. Thank you very much, Michael.
Thank you, Henry.